Joining me in the studio is Dr. Johannes Lindenmeyer, who heads the Salus clinic in Lindow, and he's a psychologist specializing in addiction therapy. Now, what we just heard is quite alarming, I think. Should we actually ban sugar or maybe treat it like alcohol and not sell it to anybody under the age of 16?
No, we need sugar. Yeah. We need sugar to live. But what is needed is a moderate consumption. Mm-hmm. And we live in times where the food industry tries to increase our consumption of sugar. And this could be dangerous in many respects. Our teeth, diabetes, and for some people, only few, but some also something like an addiction.
So actually there should be something written on the food saying so and so much food, sugar is actually in it. Is that necessary?
That's necessary for many reasons, yes. Yeah. That should definitely be the case. And the best way to have it simple is like traffic lights. You have the green, yellow, and red dot. But that's what the food industry does not want.
Does not want so far, yeah. Well, are there actually similarities between the different addictions? I mean, whether you compare now sugar or something like alcohol?
There is a final pathway that's in all addictions, and that's the permanent changes in the reward system. But the addictive potential of the substances are very different. Mm-hmm. There are highly addictive substances like heroin or nicotine, and sugar is sort of at the low level.
Mm-hmm. But it's more or less just a gradual difference. The fundamental similarity is in the brain.
Yes, you could say so, although for having a high addiction potential, you need a two-phase effect. Mm-hmm. And this two-phase effect, in the case of alcohol, is much stronger than for sugar, for example.
And what does that mean, two phases?
That you have an immediate rewarding effect, and afterwards you have a negative effect. It's not as strong as the positive one, but it lasts longer. Mm-hmm. So that increases the probability that you repeat your consumption.
And when we eat sugar, I mean, with a birthday party or something, we will not have a hangover the next day, right?
Exactly, that's what I mean.
The difference. Yeah. Now, if I eat chocolate, and I love to eat chocolate, but I always know the point when I have to stop. Why are there people who can't stop?
Yeah. That's something we don't know yet. There may be some genetic influence. Obviously, there are, if you are in certain stress situations or if you have traumatic experiences, but we can now explain how it happens, but we don't know yet why it happens.
Mm-hmm. Now, you treat people who are addicted to alcohol, and you have certain therapies. How do they work? And could something like that also work with sugar?
Yeah. It does already work that way. One thing is willpower, but as we now know, willpower is not enough. We need training. People have to develop new automatic responses to certain stimuli so that they will not drink alcohol and not eat sugar in a certain amount.
And how can you help them in doing that, in getting those new stimuli?
We confront them with those stimuli, and they repeat and repeat new behavior.
Thanks a lot for the talk, Dr. Johannes Lindenmeyer.
Thank you.